The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
Welcome to Health Connections. Tonight we're looking at small, affordable, and easy ways to change your family's nutrition for the better. Stay tuned. You're watching Health Connections. Good evening and welcome to Health Connections. I'm your host, Stacie Beecham. Tonight, my guests are Michaeleen Bouroughs, dietitian at Mayo Clinic, and Jen Haugen, dietitian at Hy-Vee Foods in Austin. If you have any questions about tonight's topic, the number will appear at the bottom of your screen. Our operators are standing by to take your calls. So, let's talk about childhood obesity, and with that, how we can prevent this situation from occurring in our homes, and how we can all just generally improve our lifestyles to make nutritious choices and increase our activity. First of all, Michaeleen, I'd like to ask you, what are the risk factors that might put a child at risk for childhood obesity?
Well, there's certainly many things that could be involved. I think a diet that's imbalanced, too many calories, too many sweets, too many extras is one of the risk factors. Certainly inactivity is another role that we would have to consider. The family makeup, who's in charge of making the meals, who's in charge of doing the grocery shopping, that kind of thing. And certainly socioeconomic factors too. Those that are of lower income tend to struggle more with making healthy food choices and activity a priority.
Absolutely. And once these risk factors once we think that a child might be at risk for childhood obesity, or maybe a little bit overweight, or maybe riding that edge between overweight and obesity, what should we do about it? We should certainly consult a physician, but at that time, what tests would they perform to see what category that child lies in?
It's really as simple as getting some measurements on your child's growth. You want to get an accurate height and a weight on your child. So there's really no test involved that you would have to have your child have a blood test done or some kind of scary procedure done. Really, all you have to do is have an accurate height and weight, and with that, you can calculate a body mass index number and chart that body mass index number on a growth curve. Usually it's helpful to have the input from your physician, your healthcare provider, either the nursing staff, someone to have some time to go through your child's growth chart with them and look at trends of growth, trends of weight gain and height gain, and where those numbers are looking for on the growth chart. So it's not a test per se, but you want to take a look at the height and weight, plot it on the growth chart, and then see where it falls. See if where they are is at a concern.
And if they are in an at-risk range, or even beyond that, and classified as, obese, what do you tell the families? Where do you start?
A lot of times I use that growth chart as my teaching tool to kind of give them some indication of how far overweight are we. There's such a thing as an at-risk for overweight level of weight and height, or BMI number, and that puts a child at about 85th to 95th percentile for BMI. That would mean of 100 children, 85 to 95% of them would be lower in weight than them. So they're, of 100 kids, they're on the high side. Only 15 other kids might be a little bit heavier. So
okay, once you tell the parent that, okay, this is where your child lies, what's the first thing you say? I mean, I know that you focus on small changes toward improving the lifestyle, what's one of the first things you do? as far as nutrition and exercise are concerned? What's the first kind of plan that you can put them on that they can really take this information home with them and put it into action?
Well, usually I have them walk through what a typical day is and have them take stock in when are we eating, what are we eating, not only what are we eating, what are we drinking, and then have them choose either a particular meal or a snack time or a particular food group to brush up on. Some of my families, they do well until evening meal, and then they have so many activities going on that the whole evening falls apart. So then we'll focus on evening time, or some families struggle with beverage choices, like, oh, so much juice and soda pop and that type of thing. So it depends on their situation. Some might be a particular time of day, some might be food choices need to be spruced up, some might be actually increase the activity levels, look at screen time, decreasing screen time and increasing activity. So it depends on every family, but usually I like them to leave the visit with me with at least 2 ideas that they know what they're going to change, and not just the parents be able to verbalize that, the child as well. I mean, I've talked to a 7-year-old today, and I wanted that 7-year-old to be able to say before she left, what are you going to do?
And what, for example, what did you tell her? What were her 2 things?
Her 2 things were choose fruit or vegetable for a snack and get 60 minutes of activity a day. The mom was going to help chart that because now she's home all day with her mom. She's a stay-at-home mom, and they were going to kind of keep track and give a sticker for every 15 minutes of activity, and then if she could get 4 stickers in a day, 4 days in a row, then she was going to, you know, get a new hair ribbon or go to the dollar store and get a surprise. I can see how a reward system would be really effective with children. Especially for the under 10 crew. You start getting the older 10 and they expect you to buy them a CD every time they get stickers. Not so much.
And Jen, maybe at that point the mother might come to you and say, okay, help us out here. What can we do? What kinds of fruits and vegetables and what kind of recipes and healthy ways can we prepare these snacks? And I'd also like you to touch on what do we do if we're that family that's so busy with sports that we almost miss dinner. It's almost impossible to sit down together, and suddenly it's 8 o'clock at night before we're eating, or we're snacking all the way from school till 8 o'clock when we finally sit down for that meal. What do you tell? I know those are 2 different questions, but what do you tell each of those situations? What do you say?
Well, I think the first thing that I tell people is start in the produce aisle. And half of your plate should really be fruits and vegetables. And it's the lowest calorie area in the entire grocery store. And so try and make sure that half of your plate does comprise your intake. I think in the Midwest here especially, it's the other way around. We think about meat, potatoes, bread, and then, oh yeah, I need a vegetable, oh yeah, I need a fruit. It may not even happen. And so I think focusing on the fruits and vegetables first, because those are very long calories, they're very high in fiber, and they're going to be filling, so that you don't keep reaching for things.
You know, my first reaction was, wow, half your plate.
Yeah.
That's a lot. You know, that to me, that takes some effort to really think about, oh my gosh, how am I going to get all those fruits and vegetables on there? So when people come to you with that reaction, what do you say?
Well, I break it down by meal. So for breakfast, what could you do? You could make a smoothie, like for instance, a strawberry banana type of smoothie with some yogurt. You can easily get 2 of your fruits, into that fruit smoothie. Having cereal with a fresh pear or fresh sliced bananas, things like that. You know, trying to break it down so that you get some at each meal. And so we start with breakfast, and then we move to lunch. What are you eating for lunch? What are you eating for supper? And then how can you get more snacks that are tailored more to fruits and vegetables?
One of the things I remind my patients, because oftentimes I get the reply, but we live in Minnesota, we can't eat very many fruits and vegetables in the wintertime because they're just not available. And I'm like, you can do well with frozen fruit, frozen vegetables, dried fruits and vegetables. I mean,
there are lots of options.
There's plenty of options. It doesn't mean if grapes were on sale and you bought 3 pounds of grapes and your kids eat them in the first 2 days, then you're not going to have any grapes. Well, I bought fruit, but the kids ate it all. I hear that too. You have to be prepared, and like Jen said, start in the produce aisle, but know it's okay to use, craisins or raisins, or you can use frozen vegetables or an applesauce cup.
Right.
It doesn't all have to be fresh. It's good to start in produce aisle, but you can't use the excuse that you can't afford all fresh or that it's not available, because it is.
There are many options. You can always do the frozen. have a stock of that available all times in your freezer. Frozen vegetables, frozen fruits, and those also make great fruit smoothies. You can also add vegetables to stir fries, put them in your pasta sauces. There's lots of different ways. Even spinach, you can wilt that into pasta sauces, wilt it into soups.
Or even take some of the quick meals that are, skillet meals and add a pound of vegetables to it. So if you take a skillet meal and you think, oh, this is kind of a quick thing, is it still nutritious? If you add a pound of vegetables to it, it is nutritious.
Yeah, and so it all just comes back to when you're sitting down, visually look at your plate. Is half of it fruits and vegetables? And if it's not, then that's kind of where an area needs to be tuned up. And then as far as snacks go, there are lots of options. You got the dried fruit. You can make a quick dried fruit mix with the cranberries and the bananas, but also adding like a high fiber cereal in. This is like a Cap'n Crunch, but higher fiber and better for you. You could always add granola in.
It's a good idea.
Nuts in.
So you were saying a mix. Like, what would that be? I know a lot of kids like granola, so that might be a good way to go about it. So you're saying a cereal, and then maybe what else would be in that mix?
I make this all the time for my kids. It's the honey sunshine, and then banana chips, dried cranberries, and then I'll put in like some of the whole grain Teddy Grahams or goldfish crackers. So it's kind of got the sweet and salty thing going on, and it's something that they like, and I even like it. So you can have those in prepackaged snack
and they
bags.
Can make it their own. Or sometimes I'll let my kids decide, well, what cereal do you want in it? What do you want? What do you want to put it in this time?
Give them choices.
And you were about to say you put them in little bags.
Yeah,
or
like little
snack
Ziploc containers.
So you just take them with you wherever you go.
Yep, definitely.
Good idea.
Yep. Some other ideas are just doing fresh fruits and vegetables as snacks. Those are very portable. Most of them are. If you don't have, you can bring them in a cooler, but otherwise, grapes, apples, bananas, things like that.
And things like these cherry tomatoes here, or grape tomatoes rather, they don't even have to be refrigerated, do they?
No, and you could use like a low-fat ranch with that, or a hummus dip. It's really quick and easy.
That's good. And so that might be a solution for the after-school sports crowd.
Yeah.
When they're either going to hit the vending machine because they're so hungry, or they're not going to get home until late, or they're even at a traveling sporting event. That might be something that they can bring these things along with them to tie them over.
I think anything that's got fiber and protein, particularly fruits and vegetables, and then you've got the nuts and things like that, that's going to help tide you over. And so eat more of those. Another example is this apple recipe here. It's just apples with sugar-free gelatin on it. And it's quick and easy. Kids can make that as soon as they come home from school. They can make it different colors by using different kinds of Jell-O. It's healthy for them,
It's
makes
fun.
it fun. Yeah. Yep.
And it seems like if they're playing a part in what they eat, then maybe they'll be a little more excited about eating the fruits and vegetables. In fact, you teach a class that helps kids to learn how to cook, doesn't it?
Little Chefs class that we do, either at the store or at the school. But just getting the kids involved in preparation. Why are we choosing these foods over other foods? They get to actually make the meal, clean up. They taste everything. So it may be something that they've never had before, but they still will try it at least, and their parents are usually very happy with that.
And that plug where she's saying they may not have ever tried it before. When I have families say, our family just doesn't really like fruits and vegetables, I say, well, you haven't given them a chance. In the research even shows a child has to be introduced to or familiar with, or at least see, broccoli on this plate maybe 35 times before they really think, oh, yeah, I'll try that. So to be a good example, offer fruits and vegetables at the meal. And maybe dad or maybe mom are not huge fruit or vegetable fans, but if you want your child to eat healthy, you have to be the role model. They're not going to get it from anywhere else.
It's good you should say that. In fact, I think we might have grown up in the generation where mom is on her saltine crackers and cottage cheese diet, but the kids are eating pizza. At least that's how it might have been at my house occasionally. No offense, Mom. But anyway, I think that to be a good role model is definitely key. And certainly the foods that you buy and have in the house for yourself are good enough for your children. And certainly they shouldn't necessarily have kid food that nobody else eats. Is that correct? Like, we should all be eating the same things.
Right.
They shouldn't necessarily get the fun chips when you know that they're not nutritious for you and you wouldn't eat them. Is that correct?
Yeah. Oh, right. And I have families that have perhaps one child in the family that's struggling a little bit more with weight issues than the other, and they'll say, well, I feel bad for the rest of the family. And I'm like, why should you feel bad if you're trying to have healthy things for this child? I mean, eating healthy is good for everyone, and it will help the weight management situation get better, but it's also going to teach the ones that aren't struggling with a weight problem how to eat well so they don't ever have to struggle with that. I mean,
Right.
It's beyond weight management. It's good health. It's healthy skin and eyes and immune system. And so even if you're watching and think, oh my goodness, my kids don't have to worry about weight, a lot of kids don't, but still eating well is going to be such a sound foundation.
Yeah. And eating whatever you're eating now is totally going to affect how your body is aging or how sicknesses may come to you 10, 20 years down the road. So
and like
it's
you
important.
said before, what cost are you willing to pay for your health?
Exactly.
So when we talk about maybe that fruits and vegetables are a little more expensive than a processed alternative, maybe that's worth it to spend a couple dollars extra to preserve your health.
And I recently, in the wintertime, actually did a class, 20 healthiest foods under $1. And I would tell you that most of those foods were in the produce department.
Okay, and give us a couple examples. Can you remember some? I know, on the spot
here. Kiwis, bananas, tomatoes, potatoes, potatoes versus potato chips. How many meals you can get out of a bag of potatoes versus buying a potato chips.
Interesting.
High in fat, high in calories. Not that you shouldn't have that all the time.
But I think that's a good point because everybody thinks potatoes are evil.
Yeah. It's what you put on them.
Yeah, because they have carbohydrate. But we need carbohydrate. I think too often people read one little snippet out of a magazine, a women's health magazine or something, and think, oh, then I better not eat that. I mean, I've had so many people come in and say, I know I'm not supposed to eat carrots anymore. And I'm like, why? Because they're high in sugar. And I'm like,
no, they're not.
Or eggs for cholesterol.
You're right. Oh, I should never eat cheese anymore because it has cholesterol, but it has calcium, it has protein. You've got to think big picture, variety, balance. And there really, so many foods are healthy. If anything, I think we miss out on trying the variety too often by getting stuck in a rut of the same old, same old.
So even if we're talking about healthy choices, we're talking about having healthy choices in the house and not having the unhealthy choices, hopefully. And then we're talking about what we can buy at the store. Let's talk about the other aspect, portion size. So we have a lot of these foods. Spaghetti, for example, it's not a bad food for you, but how much should we really be eating of that? Cereal, how much should we be eating of that? What's a healthy snack size versus what's a healthy meal size versus what should a 4-year-old eat, compared to what a 35-year-old would eat?
I think looking at the size of the plate is one area that, you can start with a child with a smaller plate, but it can also be the adult with a smaller plate. And just, again, focusing on half of that plate being fruits and vegetables. But, pasta and things like that.
Then it's a lot easier to fill up half your plate with food.
And if you compared it, which I do this with people, is compare the smaller plate with the bigger plate, put a cup of pasta on the smaller plate, cup of pasta on the bigger plate. Of course, it looks much bigger on the smaller plate, and then you feel
more
a sense of gratification. Right. Yeah, right, just with that.
So you're saying we should all be using small plates?
I think our plates in America are way too large.
Yes.
Another place to consider on the whole portion issue is to use the nutrition facts panel on the labels. If it says 5 Triscuits is a serving, that's probably a good idea that you should have 5 Triscuits at a time and then put the rest back.
But it's hard to stop when you have the whole box in front of you. So then what should you do?
The rule at our house is for Doritos. We like Doritos, yes indeed. But my kids know that 7 Doritos is a serving. So you get 7 Doritos out, you put them in a small bowl or on a napkin or whatever, and you roll them down and tape it shut and put it back in the refrigerator, or put it back in the cupboard, and then sit down and eat your Doritos.
That's a good way to do it.
Not saying that we're perfect, but that's the recommendation. They know that's what I expect them to do.
Instead of taking the whole bag.
Right. You can eat a whole bag of Doritos and not realize it.
Absolutely. You look down and it's gone. Absolutely. So we talked about healthy choices. We talked about portion size. We talked a little bit about lifestyles like that aren't home for dinner maybe. Let's talk a little bit, Jen, about how you consult people who are always on the go.
Always on the go, need portable snacks. First
or
of all,
portable meals.
Portable meals, yeah. If you can get a cooler, that's obviously a really good choice. So you can put some things in there that do require refrigeration. But if you don't, of course, you can think about, again, the mixes with the nuts, whole grain crackers with string cheese, those types of things. You can do like wraps, make them up with vegetables and meat. and low-fat cheese, and have those pre-packed and ready. I think the key is to plan.
Yes.
Because if you don't plan, that's when things kind of fall apart. And so if you can plan the night before what you're doing the following day and have that all ready to go instead of relying on a last-minute vending machine or I'm going to run through the drive-through. There are things that you can keep in your car. You know, you could do even the 100-calorie snack packs. Of course, fruits and vegetables keep very well. You've got the dried fruit leathers, bars, high-protein, high-fiber bars, too.
And I've also heard that to prepare your fruit and vegetables right when you get them home from the store is an easy way to save time. That way you can grab a handful of carrot sticks, or
Exactly.
you can is that,
Yes.
do you recommend
And
that?
even like
because I can see if you didn't do it the night before and you wake up and you're in a hurry to get
Yep.
out the door,
You don't
you're
feel like
thinking,
doing it.
I don't have time to peel the carrots. So what do you say?
Either buy it pre-done, which completely is
And
fine.
it's sometimes
yeah.
worth the extra money
Yeah,
to have it already done.
Yes.
You know, there's been times, even myself, I'll buy a head of broccoli or cauliflower and I don't do the pre-work when I bring it home, and then it sits there, and then I don't feel like doing it, you know.
And I
Nobody's
have found
perfect, like you
dead
said.
stalks
so.
of celery in the
Yeah.
back of my fridge, too.
If you pre-prep it,
But if I do it right
Yeah.
away, it's done.
And
Yep.
it seems like
Yep.
if you prep it, you're less likely to have those things go rotten without even
Exactly.
realizing they're
Right.
in your fridge,
Exactly.
which happens to all of us, I think.
Exactly.
But
And
even when you're grocery shopping,
Excuse me.
kind of think about calculating in that period of time to clean and wash the vegetables as a part of your grocery shopping experience, or how much time is this going to take? Count in the fact that, oh, I want to wash and clean the grapes and, you know, prepare the vegetables and do that as part of the time that I need to do this grocery shopping right.
Right.
And certainly ask the family for help. If they're going to be eating the food, they should be helping.
And I think it's great to get the kids involved in grocery shopping. So you take them in the produce aisle and say, okay, you look for something green, you look for something red, you know, depending on their age, or something that starts with the letter A, or whatever it might be. But the more they get involved, then you can bring that home and they'll help in the kitchen. And I think the more you can get them involved in planning and preparing meals, the easier it is for them to try things.
Right,
Yeah.
absolutely. So we established first, right off the bat, that diet and inactivity might be two of the risk factors. Let's go to the inactivity portion. Let's talk about, both of you certainly have had a ton of experience with clients and patients talking about how can we increase our activity, or I don't have time to exercise, or why is my child not, you know, and maybe not all children are going to be interested in sports. What can we do for the kids who aren't getting activity from their natural the natural things that they do during the day? What can we do? Can we do family activities? Can we, you know, what do you say?
Well, it depends on the child's age, too. You know, a child might want to take a walk with the family, so it might be something that the parent has to initiate because a child can't go for a walk by themselves. It could be something like that, or it could be a bike ride with a friend. It could be, especially, again, I get the whole, well, it's winter for a long time here, so we can't exercise. Put on music and say, you know, dance and jump around and do jumping jacks to 3 Hannah Montana songs every night before you go to bed. I mean, that is something that I said today for a patient. I mean, things that the kids understand and get. They can
And
do
enjoy.
them. Right.
Yeah.
You know, so it's not a drag. It's not like, oh, you have to do this exercise video. It's like, okay. And maybe by the 3rd week, you can do 5 Hannah Montana songs before you go to bed. And, you know, it's just dance and jump and play and, you know, get the kids involved in thinking about what they like to do.
Maybe instead of the parents' aerobics video, they can do
Right.
Hannah Montana
Right.
with them occasionally.
Now
and
that's going to work
encourage them.
better for the little girls. Some of the boys, we have to challenge them with how many, you know, sit-ups or jumping jacks can you do, or, you know, let's get you ready for your next sport, or, you know, their next person that they, you know, LeBron James, they're working on
Right.
being as good a basketball player as that, or something like
Can
that.
you race around the house 3
Right.
times? How fast can you do that? You know,
Or
something like that.
a lot of times I'll even throw out the idea of a scavenger hunt and have the parents come up with 5 things that the kids have to look for, and then they have to go run around the house and look for it. You know, or just little things like, before you find this treasure, you have to do 10 jumping jacks and 5 sit-ups. I mean, it's not that hard. Kids will love it if you make the effort to take time
And
to
if
do
you
something
think
with
of it,
them.
and
Yeah.
if you're thinking of it, then
And kids love you know, continuity. If every night after supper they get to do their dance thing, or every night after supper, well, that's our scavenger hunt time. Of course, why aren't we, you know, they'll miss it if you don't do it. So it's not that hard. You just really, parents, especially for the younger crowd, you have to take the responsibility to say, I need to be active with my child. And another thing, it's on the flip side of being active, is reduce the inactivity. And I had a child today that the mom says, she really likes to read and draw and color. And I'm like, well, those are great things, but try to reduce the time of sitting for 30 minutes, more than 30 minutes. So, you know, if they've colored and drawn for 30 minutes, then think, oh, let's get up and do something different. You know, you don't have to be super active, but you have to reduce that sedentary time.
And I think the best thing is to have the parents do it with the child, not you go do that, you know,
Oh,
while I sit here and watch you.
And I've heard too, and I think I'm guilty of this too, I think, oh, I don't have time to do that, I need to do the laundry, or I need to do that. Well, maybe it's, can you help me carry this laundry upstairs? Or
take
carry
each pair of socks up to your room separately.
Separately.
Up
Several
the stairs
trips.
you go.
Yes. Seems like they're... So Jen, we talked about all these healthy recipes earlier. Where can we find these?
You can find these, Hy-Vee.com has a wealth of recipes. And also I'd point out too is we have weekly menus that make it really easy for families to just grab or get it sent to their email box. And has the whole shopping list, the recipes, everything's pre-planned with fruits and vegetables, so it's really quick and easy. And
there's a new food pyramid, isn't there, that we didn't get a chance to talk about, but that you can tailor to your own age and your own habits. And where can we find that? Is there a good website for that, or is it just kind of...
It's mypyramid.gov.
Okay, super. Yeah. All right. Well, thank you guys for being on the show and for all this good information that we can take home and implement into our family lives. Thank you for joining us on Health Connections tonight. Next week, we'll be talking about the statewide health improvement program that will be taking effect in Minnesota July 1st. Be sure to join us next time on Health Connections.